So today's video is about menopause and HRT. Now the menopause is when in a woman, as she's naturally aging, she's going to lose her levels of estrogen. And this means that eventually the body will stop producing an egg every month. So the first thing women tend to notice is their periods change. They become irregular. They can become heavier or lighter, more frequent, less frequent. And the average age for these symptoms to begin are between 45 and 55, on average 51 is the typical age. So if you think that we're going to live to about 82 years old on average, that's about 30% of our life is menopausal. So it's definitely worth thinking about how best to manage it. And 1 in 100 women actually have an early menopause before the age of 45. If it's before the age of 40, we call it premature ovarian failure. So what are the symptoms of the menopause? We've mentioned the periods, that's the first thing people tend to notice. And then we always imagine hot flushes as well. And actually 75% of women do struggle with hot flushes, but actually it's much more than that. Estrogen has a role all over the body in lots of different aspects of the body. So the symptoms can be really debilitating and wide ranging. They can include things like joint and muscle pains, worsening migraines, depression and anxiety. They can have brain fog. You can have palpitations. You can have sexual dysfunction, where you have vaginal dryness, you have a lowered libido. It can be painful to have sex. You can have urinary symptoms, frequent infections, problems like that. And what's often surprising for women is that these symptoms can last decades. Moreover, there's negative implications, more than just the symptoms, for the actual physical aspects of the body. Once these estrogen levels decline, women are at a much greater risk of osteoporosis, with thinning of the bones that could possibly lead to fractures and further problems later on. But also after the menopause, women have increased risk of obesity, type 2 diabetes, heart problems, the list goes on. So how do we diagnose menopause? Well, as long as someone's over 45 and they've got symptoms of the menopause, then that's enough to go on. We don't need to do blood tests unless the woman is under 45 years old, because then we might need to do blood tests to confirm.
Okay, now we're going to talk about management of the menopause. And there are lots of things you can be doing before you even think about going to see a GP. Most of these do revolve around improving your lifestyle. So if you're a smoker, this is a great time to think about stopping smoking. If you're overweight, it's a great time to think about losing weight. Also try and avoid the triggers for those hot flushes. That can include things like alcohol, caffeine, spicy foods, all the good stuff. If you haven't got enough calcium and vitamin D in your diet and from sunshine, then you may need to supplement. Think about trying to exercise more and finding ways to kind of decrease stress levels. Yoga, meditation, whatever works for you. Also, you can get over-the-counter vaginal moisturisers if you're suffering from vaginal dryness. So these are very safe to use and can improve your symptoms. HRT, hormone replacement therapy. It does what it says on the tin. You've lost the estrogen and it's never going to come back. So we're going to replace what you've lost with HRT. And the good thing about HRT is essentially it prevents all those symptoms we talked about, all those menopausal symptoms. It can really help reduce those symptoms. And all the risks associated with menopause that we talked about, like diabetes and obesity and heart risks, they can also be reduced with the use of HRT. Specifically osteoporosis. It's very useful for preventing osteoporosis, the thinning of the bones. So it sounds almost too good to be true, doesn't it? It's almost like we should make sure every woman, every over 45 has got HRT. Why is there this concern and worry about HRT? Well, that's because quite some years ago, there was a study called the Women's Health Initiative. And this concluded that it was going to be dangerous for women because it increased their risk of breast cancer and heart disease risk. So everybody panicked and the prescriptions for HRT plummeted for years. But then we've looked back at these studies, we've looked back at other studies, and actually what we now know is that a lot of those risks came from the older forms of synthetic progesterone which was used. Because when you have HRT, you need estrogen to boost what you've lost, but you also need progesterone to protect your womb, unless you've had a hysterectomy. And it was the older form of progesterone which was giving these increased risk. So nowadays we tend to use a more modern form of progesterone, which is a more natural form of progesterone called micronized progesterone. And we know that when this is used with estrogen, there is no increased risk of breast cancer for the first 5 years. And that's all that's been studied. It's probably longer, but we can say that for the first 5 years there isn't. There's no increased risk of death with breast cancer if you're on HRT. And we know that when the HRT stops, any risk also stops with it. So for the majority of women, the risks are very small for HRT and the benefits can be really huge. The tablet forms of HRT do, like the contraceptive pill, come with them an increased risk of blood clotting. So are not suitable for women who've got migraine with so-called aura, or if they've had a history of blood clots in the past. To be honest, I don't prescribe these at all anymore because I think when there's an option that doesn't have an increased risk of blood clot, let's go for that option. So I tend to always prescribe what we call the transdermal route of HRT. So that is either a patch, a gel, or a spray. And with that estrogen component, you need the progesterone. And this micronized progesterone is best given in a tablet form that you take at night because it makes you a bit sleepy, which is often beneficial, called Utrogestan. And depending on whether you're still having periods or you've stopped, you either take it for 2 weeks out of 4 or you take 1 tablet every night. If you want to still have some contraceptive, because remember, you can still get pregnant even when you're going through the menopause, so don't assume you can't, then the Mirena coil is a good option, and that provides the progesterone component to protect the womb, in which case you only need to have the estrogen part of the HRT. Side effects of HRT can include breast tenderness, bloating, low mood, and some irregular bits of spotting or bleeding. If that's happening for just a short time when you're starting HRT or when you're changing your HRT, we kind of think that's acceptable, but if it's ongoing more than a few months, then please do speak to your doctor about it. Alternative treatments. A lot of women say they don't want HRT, they want to try something more natural. But actually, the type of HRT I've just been describing is actually made from yams, so itself is very natural. And we don't recommend the use of complementary alternative therapies for HRT because there just isn't the evidence to suggest that they will work, and sometimes they are not necessarily safe. They can interact with other medications and we don't really know the side effect profile. Some people do use antidepressants to try and help with the hot flushes, but again, there's not great evidence for it, and we do know that antidepressants can't help with the mood problems if the mood problems are associated with the menopause itself. Testosterone. We know just like estrogen, testosterone depletes after the menopause. In fact, you have 3 times as much testosterone before the menopause than you do after. And this can have significant impacts on women as well, especially with low libido and brain fog. In fact, on the NICE guidelines, it does say that women can be prescribed testosterone if they're already on HRT and still suffering with low libido. Unfortunately, a lot of GPs aren't able to prescribe this, so often it has to come from a menopause specialist. But if you're thinking about testosterone, then do speak to your GP and they might be able to point you in the right direction at least. And when should you stop HRT? We used to worry a lot about this. We used to put age limits on it or the amount of years. And actually what we know now, and bearing in mind that we've said the symptoms can last for decades, is that women can safely be on HRT for really as long as they need it. We know that it's safest if you start HRT within the first 10 years of your menopause. So actually, you're better off, as soon as you're getting symptoms of the menopause, getting started early. That's actually safer. And then your symptoms can be improved for much longer. So I think in conclusion, what I would say is don't be afraid of HRT. I think for too long, women have kind of suffered in silence, embarrassed to talk about sexual problems, embarrassed to even think about the menopause, not allowed to talk about it. It's been kind of stigmatized. And a lot of women don't even know that the symptoms they're struggling with are linked to the menopause. The amount of times that women have said things like, I just don't feel like me anymore. I feel like I've lost the real me. And then they go on HRT and they find the real me comes back. So I would say, hopefully now you've got lots of information, a little bit about the risks and the benefits of HRT. So when you do think about speaking to your GP, you've already got some good knowledge. What would be helpful as well, there's a scoring system where you can plot your symptoms called the Green Climacteric Scale. I'll put a link in the video. And if you fill that in before you speak to your doctor, and then it's often useful to fill it in again when you have a review once you've started on HRT to see where things have improved or where things may need to be tweaked. Okay, I hope you found that really helpful. Share with anyone else you think might also find it helpful, and I'll see you on my next video. Thanks so much.